So let's bring in our good friend from Akron Children's Hospital Sports Medicine Center, of course, Dr. Joe Congenie with us on WAKR. And Joe, you're taking us to the mats, right, this morning?
Yeah, let's go to the mats, Ray. Let's shine a light on those hardworking young athletes in the wrestling room, okay?
Sounds
They've
good.
been working hard all year. They're headed down the stretch now of the most important matches of the season. Like all the rest of the athletes and students, everybody's hoping that the COVID variants and the virus is going to decrease because they've had their share also of cancellations and pauses. In fact, one of the best-run tournaments in our area that we usually cover, called the Bees Tournament, at Firestone High School, was canceled for this weekend. But hopefully things are going to open up as we get into the big matches of the year here coming up in February and March. And so I wanted to talk about rashes in wrestling. Wrestling is the sport where we see these rash issues the most. And, of course, it's obvious. There's a lot of skin-to-skin contact in wrestling. And, in fact, as high as one of the articles I read last night, 20 to 25% of time missed for medical reasons, 20 to 25% is due to rashes in this sport. Nothing is worse, in a lot of years in the field of sports medicine, than seeing a hardworking wrestler who's worked throughout the season, maybe even all year round, and they get to the big matches of the year in February or March and they can't wrestle because they have a rash that is contagious. And so now's the time here in January to really do our due diligence, be on the lookout for these rashes. There's really three types, Ray. There's bacterial rashes. The bacteria usually are staph and strep. The one that I see the most in a career has been impetigo. Impetigo, we see it on the face, and it is a red rash, but it has this weepy-looking, honey-colored, they call it in all the books, but a yellowish to me, yellowish-looking rash, impetigo. The other one is called a furuncle, which is a reddish rash around a hair follicle. And then also, of course, MRSA is still around, that Staph aureus type infection or rash that, pretty resistant to certain drugs many years ago. That was high a few years ago. I think it's coming back down a little. But all of those are bacterial infections. And they're really going to need to be treated by antibiotics usually when they get going to get them better. So seeing them early and treating with antibiotics for the bacterial infections. The second one are fungal infections. And, of course, the most common fungal infection is ringworm. And ringworm is the classic round red lesion that's clear in the middle. We see it on the arms. We see it on the face. When we catch it early and there's only one or two of them, they're treated very easily and well by a topical antifungal. But when they get all over the body, we sometimes have to treat them with oral treatment and medicine to get rid of fungal infections known as ringworm. A lot of times one of the giveaways is kids will be on steroids like you are for a lot of other rashes, and steroids will make ringworm worse. So that's one of the things to know about ringworm. The third group, and it's about 30% of all of these kids get. They get about 30% are bacterial, 30% are fungal, 30%, probably the worst one is the herpes, called herpes gladiatorum. And viral infection that might have some systemic symptoms, sore throat, maybe even some fever, and just not feeling good. And these are clusters, they call them grape-like clusters of blisters that you'll see pretty much anywhere on the body. And when these get going, they're very contagious. And when these get going, they're very hard to treat. And so they need to be treated with medication for about 2 weeks. And if we miss them early on, the kids are going to end up missing their big matches because they won't be able to wrestle. So about 30% of each of those three is the rashes that we see. And so prevention-wise, now's the time for prevention, Ray. That's why I bring this topic up today. We want to treat these early, and then they're much easier to treat. So observe closely, and if you have any questions, the athletic trainers, our hardworking people that are at the schools, bring the rash to the trainer, and they'll get you into the right people to get these treated appropriately. Coaches are really good at knowing rashes, too. They've been around them so long. Secondly is this was new to me, but reading about it a little bit, fingernail hygiene. As a lot of these will be scrapes and scratches where these infections and rashes will take hold. You want to shower immediately after practice or matches. Don't wait a long time to take your shower afterwards. That's good prevention. And clean the mats and the workout clothes daily. So my question for the day, you always get these so right. You're so good, Ray. Do you know what the uniform type in wrestling? Most athletic people won't know this question. 95% of what the name of the uniform type that wrestlers wear?
Singlet.
You're amazing. It's called a singlet. You're exactly right. And so wash those things daily. Make sure that we're washing them daily. The only other pearl I could give from years of treating this, it's rare for me now, that's hard for me now, is that a lot of times it's not as clear-cut just one of these three from another. We see a lot of mixed lesions, and so sometimes they need to be treated. We have good help from the infectious disease team at our place at Children's that does a great job and gets these kids in within a day or two. So we get these rashes treated so they don't miss the big matches of the year coming up. Now's the time to get on these rashes here in January, not seeing these kids sit on the sidelines in February and March.
Great stuff this morning, Joe. Really interesting, too, and you're exactly right. I love the adjustments and taking care of those wrestlers on the mats. Man, do they work hard, my friend. Thanks, Joe. Appreciate the time, the visit. We'll catch up with you again next week.
Thanks, Ray. Have a great week.
You too, my friend. Dr. Joe Congini, Akron Children's Hospital Sports Medicine Center. He joins us Wednesdays for over 25 years at this time on WAKR.